Some breaking updates coming in. A major meeting of the Health Ministry is going to begin shortly. We are learning that this meeting will be chaired by Health Secretary of the country. The focus is going to be on the reason behind the deaths and the misuse of cough syrups and the quality of medicines. Isha, my colleague, is now joining us live right now for more on this. Isha, good afternoon. Can you bring us up to speed with, firstly, the number of people who have lost their lives because of this poisonous cough syrup, and what is going to be the focus of this meeting that's going to be chaired by the Health Secretary?
Right, so as we speak, I think the meeting has begun. This is a meeting which is being held at the Health Ministry. It is being chaired by the Health Secretary of the country, and in fact, all drug controllers in states and everyone associated to this meeting, everyone associated to public health will be a part of this meeting. So this is on a large scale. In fact, sources have also confirmed to us that the meeting will be discussing the rational use of cough syrups. But as the death toll right now currently stands at 11, 9 in Madhya Pradesh and 2 in Rajasthan. And the Health Ministry, the first day that they gave out this statement, they did state that there is absolutely no correlation between toxic substances and the cough syrups that were prescribed. But again, this is not a one-off, Hina. In 2022, a Noida-based pharmaceutical company was under the scanner for allegedly having toxins in their cough syrup, which led to deaths of children across the globe. In fact, to understand the situation better, we actually have a child specialist here with us. He was also a part of the IMA, so he will explain it to us about what is and about the issue that persists, and also if cough syrups can actually be toxic. Sir, बहुत सी बातें हैं, there is a lot of conversation here. Health Ministry ने एक तरफ कहा कि शायद टॉक्सिसिटी नहीं है, लेकिन फिर उसके बाद एक एडवाइजरी भी इशू की. कुछ टेस्ट में पॉजिटिव आए हैं कि क्या पता कहीं कहीं लिंक्स हो सकते हैं टॉक्सिसिटी, लेकिन अभी कुछ क्लियर नहीं है. आप इतने साल से इसी फील्ड में हैं, आपको क्या लगता है?
Look, one thing is very clear, that so many deaths have occurred. So one thing is, this thing is very clear. And it raises serious concerns about the quality control, the manufacturing standards, and the availability of the over-the-counter drugs. Now, one thing as a pediatrician, I will like to make it very clear for the public awareness is that below the age of 4 to 6 years, we cannot give cough syrups. So evidence-based practices and studies have shown that cough syrups below the age of 6 years, they don't have any beneficial effect. If we want to treat cough, we have other things, like we have to first diagnose what is the cause of cough. Is it allergic? Is it pneumonia? And then accordingly we will treat. So cough syrups, they are not recommended according to our pediatric bodies, may it be Indian Academy of Pediatrics or American Academy of Pediatrics. Below the age of 6 years, we cannot give. Even after 6 years, if we have to give judiciously under the supervision of a pediatrician or a doctor.
You've said a very important point. You said judiciously it should be given. But these particular states that we're talking about, this was supplied free under the state scheme. So this was probably not happening without the approval of the Health Ministry. And Health Ministry is definitely aware about the side effects of it. So how do you think they have agreed to supply something like this when it's dangerous, as you were also pointing out?
It is a matter of investigation, and a thorough investigation should be done. I have told you that it raises a serious doubt not only on the quality control, manufacturing standards, but how come these OTC drugs are available for the children? So once a cough syrup we cannot give to a small child, it cannot be given. So it is a rule that we cannot give cough syrup to a child, because these cough syrups, they have cough suppressants like dextromethorphan, or they have antihistaminics or decongestants. They are harmful for the baby. And moreover, if this cough syrup is contaminated with industrial solvent, then it can be very hazardous. They are not to be used for the children.
Right. So Hina, you did hear Dr. Ravi here give us details. He said that definitely there is something that may have been a problem, and there needs, this is a matter of investigation. Back